So for today, we have one of our new faculty members to present for Grand Rounds, and for an introduction, I'll turn it over to Dr. Pandya.
All right, thanks everyone. To get me to dress up is a big task, so Jackie, here. I have the honor of introducing Dr. Hill for Grand Rounds. Dr. Hill is one of our new faculty. We've had a lot of new faculty in peds ortho, and to get someone who is mid-career and already very nationally and internationally known was a huge surprise for us. And she's been such a great addition, even in the past couple months that she's been here. Just a background, Dr. Hill earned her bachelor's degree from Princeton, where she was on the crew team, and that makes 6 former collegiate athletes on the pediatric orthopedic service, just to let you know. So we have a 50% hit rate with former collegiate athletes. She got her medical degree from Baylor, then did a residency at Boston and her fellowship as well, too. And she spent her last decade or so at Texas Children's and Baylor College of Medicine, where she became, as I mentioned, an international and national expert in limb lengthening. She's on multiple societies, POSNA, LLRS, et cetera, and just has been amazing in terms of the past couple months of working here and really teaching our residents from a different perspective and bringing her experience. So without further ado, she'll be talking about reflections from a mid-career female orthopedic surgeon, and welcome, Dr. Hill.
Thank you for that kind introduction. So I have one disclosure, but it's not relevant. So a couple months ago when I started working on this talk, I got asked the question, why do we ask a new attending to speak at Grand Rounds? So I think the answer to that question is to learn about the person. So I thought there were maybe 2 ways to approach this. The first way, probably the easier way, maybe the way I should have gone, but we'll see, was to just kind of tell you what I do and what I love to do, which is limb lengthening, deformity correction, some club foot. But instead, I decided to have a conversation and kind of give you a little bit of a career reflection to provide some lessons that I've learned both at home, with family, and at work. And my hope is that this is a little bit more inclusive for everyone in the audience and doesn't just speak to like 5 people who are really interested in limb lengthening. So my objectives today are to introduce myself and the factors that led me towards a career in orthopedics, highlight the successes and failures of my first 10 years of practice as a pediatric orthopedic surgeon, and discuss the personal challenges that female orthopedic surgeons, all parents who are orthopedic surgeons, and then maybe all physicians may have in common, and try and share some of my strategies for navigating life. And I have life in quotes because I think we hear a lot about this kind of work-life balance. And to me, that's not the right word. I think everything is life. And there's work, home, family, and it's all one big picture. So I think we're maybe using the wrong vocabulary. And when we use the wrong vocabulary, it phrases the question wrong, and then we get the wrong answers. So I'm hoping to kind of frame some of that and maybe open up a conversation about that. So just to introduce you to myself, I grew up in Great Neck, New York. So for people who don't know where that is, it's on the northern part of Long Island, which is part of New York. It's best known for where Scott Fitzgerald was known to be inspired to write The Great Gatsby. And it's West Egg, which is a fictional place in the book, but it's supposed to be based on Great Neck. And those cute little pictures are of me and my brother, Michael. And really, we spent our whole childhood playing tennis. And I grew up being told my parents that I could be any kind of doctor I wanted to be. So the way that neither of them are doctors, which is kind of interesting because that's, as an outside perspective, like what they thought about doctors. They thought they were really esteemed and, very professional. But the way that I internalized this, because I was an athlete, was that I was going to be an orthopedic surgeon. Like, that's just what I thought when I was in high school. So when I got that question, when I was going through residency interviews and whatever interviews, it would just be like, I don't know, that's just always what I thought, right? I just had to internalize that. So I went to Princeton, was fortunate to get an early decision. I met my husband, Brad, there, and I majored in molecular biology. And I know it was mostly because that was the course for pre-med. I knew I was going to be a doctor that met all the requirements. In retrospect, I wish I had studied something like Latin or something that maybe would have led me to be a little bit more like well-developed person and not just focus on science. But I really enjoyed my career in molecular biology. And I, again, brought in the athlete part to that degree and writing my senior thesis on XY females and their athletic advantage and how they excel in Olympics. So that was a little bit kind of not just doing the basic science part of it. I tried out for the softball team. I tried to walk onto it, but I didn't. So I ended up rowing crew, which you can, I don't know that it's really a failure, but that was kind of my pathway because we did not grow up having crew where I grew up. Again, just like kind of with that underpinning thought that I was going to be an orthopedic surgeon, for my summers, I went to the alumni network, which is really robust at Princeton, and I found a female orthopedic surgeon, and I spent my summer shadowing her. So I had a really strong female role model right from the get-go. I went to medical school at Baylor College of Medicine. Part of the reason I went down there is because my future husband got a job in Houston, in Texas, in the oil and gas industry. And so while I had a few choices for medical school, we kind of went down there together. I then did an away rotation at MGH, and I was fortunate to match at Harvard Combined Residency Program. The picture with the 12 people is my residency class, so you can kind of see that I stick out like a sore thumb in my lilac dress that I still have hanging in my closet. But obviously, my experience was very different than my male colleagues. I was fortunate to have really great female role models there, like Dr. Sabatini. And then I stayed for my fellowship at Boston Children's Hospital, and the picture in the bottom right is my fellowship class. So you can already see that the composition's like a little bit different for pediatric orthopedic surgery versus kind of the general orthopedic surgery residency. And then I just included in the top right picture, this is like kind of a montage of pictures, a picture of me, and that's my grandfather who just passed at the age of 104 at my medical school graduation. So I definitely, I don't know that I realized this as I was going through residency, but I obviously internalized the fact that I was different than my colleagues. And so one of my research projects during residency focused on sex diversity in orthopedic surgery. And part of it was just looking at the percentage of orthopedic surgery residents that were female. So only 13.2% of orthopedic surgery residents, as opposed to about 50% of medical students. So big difference. And then we sent out a survey which looked at how we could recruit more women. So two things were just increasing the exposure to orthopedic contact during medical school, and then increase female mentorship or same gender mentorship. A more recent study that was published in 2020 showed that we still only had 15.5 orthopedic residents. So better, but not that much better. Not sure what for the percentage was for the class that we just matched. So one lesson, and again, not sure that I learned this at the time. And I don't know that this would have changed my path at all, because again, I really was set on orthopedics from the very get-go, but kind of in retrospect that, orthopedics definitely is a male-dominated field. In retrospect, I was very fortunate to have female mentors very early. But, my experience both through residency and for the rest of my career is going to be different than a lot of my colleagues. And so, how do I navigate that? I tried really hard during this talk to separate, either go chronologically or separate my family and the career stuff. Obviously, that's impossible. So just to kind of throw out that I got married during residency. I was a second-year resident when we ended up getting married. And we have 3 kids, Joseph, who was born about a year after I passed my boards, Matthew 2 years later, and then Emma 3 years later. So you guys heard a little bit about how I developed a subspecialty in limb lengthening and deformity and clubfoot. So I think the way that I approached it is maybe somewhat unique or maybe almost old school. So I think there's a lot of push towards this double fellowship where you come out and you're super subspecialized and you already have something that's developed. Pediatric orthopedic surgery is definitely one of those subspecialties now that still is very general. You could walk out of pediatric orthopedic surgery doing kind of anything. And I knew that there were certain things that I didn't want to do. I knew I probably didn't want to do spine and I wasn't going to do PAOs, but really the rest of it was really interesting to me. And that's part of the reason I chose pediatric orthopedics. But when I went into my first practice in Houston, people were pretty general. And then some people left and some people came. And so there was this opportunity for me to start to develop a niche. And the way that I tried to identify that is like kind of where was there a clinical need? What things were we not doing a lot of? What things could we do better? And so I kind of picked out a couple of things that kind of matched my interests and I thought that I could really bring something to, and then figured out how to develop those things. So I couldn't resist just sharing a couple of cases. So one thing that I have been, I think, pretty passionate about in terms of the limb lengthening and deformity stuff is trying to get away from the use of frames. And I do put on frames. That's like part of any limb deformity practice. But I think there is this avenue to do these kind of fixator assisted or acute corrections and then let patients weight bear immediately without having a frame on for a long period of time. So this is an example of a teenager who presented to me with multiple knee dislocations, had significant femoral aneversion and genivalgum, and we did this fixator assisted nailing where I derotated her, improved her valgus, put a nail in, and she could get up and walk the next day. She still had a dislocating kneecap, so my sports partner fixed her MPFL, but just an example of how you can do this really kind of complex correction very nicely. This is another patient with a similar technique who had multiple surgeries by a previous surgeon for Blount's disease, but had this residual deformity in her femur. She got a fixator-assisted nail to correct her femoral valgus, and then I exchanged the nail for an internal lengthening nail, and then she got lengthened that way. And then kind of interesting technique. So we know that patients do really well with these intramedullary lengthening nails, much more so than external fixation, especially on the femur where there's lots of soft tissue and they can get lots of contact issues. And so there are people who have developed this extramedullary nailing with an internal nail to prevent deformity correction. So this patient has Olliers disease. His first lengthening, the first 3 pictures on the right, were for when he was 5 years old, so way too young to get an intramedullary nail, but I didn't want to put an external fixator on him, so we did this external medullary lengthening, and then a couple of years later, still had a huge leg length discrepancy, so he got a second nail that was intramedullary. So lesson learned from that, again, this is thank you for dealing with my reflections and my pondering. People who have spent some time with me in the OR and clinic have realized I'm doing lots of big thinking, but so medicine's continually evolving. I need to evolve with it. So when I was a fellow, the precise nail was coming out and internal lengthening nail was coming out. So I saw one of them when I was a fellow. And I probably have done, 50 plus in my career. And so, that's obviously and I'm sure everyone who's been in practice for a while, pedicle screws weren't a thing, right? So you need to figure out how, even when you leave fellowship, how you're going to gain new skills and perform those so you can stay up with medicine and do well. So not only like finding that niche, but there's obviously something else to becoming an academic surgeon. There's the clinical portion of it, but there's also the academic portion of it. And part of that is developing relationships with mentors so you can improve your skills. And also collaborations with them. So one way, limb lengthening is a relatively niche field, so there aren't that many of us, and there's probably little pockets of that kind of distributed through orthopedic. So I'm sure many of you are familiar with Dr. Paley, but he runs a congenital deficiencies course, and to me that was very interesting just to see the techniques that he was doing. So I, got on a flight. My family came with me. They were at the beach. I was in the back of a conference room with Dr. Sabrawal. And, not only do you put yourself out there by meeting Dr. Paley, who I established a very nice relationship, but I brought my cases to share with him so he understood what I was trying to do and he could help me. And then I continued to email him and Dr. Sabrawal when I had complicated and interesting cases that I wanted their opinion on, because none of us know everything. And the thing about medicine is there's a lot of grades, so there's not one right answer. And so you need to kind of get that information. And so you need to establish these relationships. So this is how I approach that. The Limb Lengthening and Reconstruction Society is a relatively small, I think we're now part of the AOS, society. We're just at like the 250 membership, so it's a really nice small meeting where everyone is in shorts and a t-shirt in the middle of the summer, and you can just walk up to everyone and introduce yourself, and it's just like one of those kind of really great societies. So I really encourage you not just to be part of the AOS, but if there are these small subspecialty societies, I've really kind of gained a lot from that. But I just walked up to Dr. Liu and I said, hey, I've done some education stuff for POSNA. Can I do some education stuff for the LRS? And he was like, sure, would love to have you. And then somehow that turns into me being the chair of the Traveling Fellowship Committee. We have our traveling fellows coming to San Francisco this year. And that position became a board member position. So, and that just came out of me just cold walking up to someone, which, I mean, I'm obviously standing up here, but that's a big thing for me to do. So, lesson learned is that stepping outside of my comfort zone has really enabled me to establish these mentoring relationships. Even sitting down next to Sanjeev and talking with him, not knowing him before that's hard for us, right? But you don't establish those relationships without putting yourself out there. And then kind of, I don't know the final piece, but another piece of kind of the academic puzzle is kind of getting yourself out there in terms of research. So the thing that has been most accessible to me is kind of retrospective clinical studies, which I have been, which have grown as I built my clinical practice. But I was also really fortunate to be included in this multi-center research group, Core Disease, which is a pediatric group that focuses on acute care issues, infection, and trauma. And there's so many benefits to that in addition to the research component of it, but the people that you meet there. And so kind of lesson learned from that is that the opportunity to be part of that group really allowed me to develop relationships with peers nationally and internationally. So not only am I getting papers out of it, but when it's time to come for promotion, there's 15 people I can ask to write me a letter because they know me and they're familiar with my work. So unfortunately, not everything was super rosy, like every aspect of our life. And so I have faced some challenges over the past 10 years. Some of these things were kind of more global, some of them more individual. So just to kind of start with the more global things, institutional, specific to I think where I was, but also bigger system challenges that we all face in medicine. So there was an increase in call burden. When I started, there was one big hospital. They added 2 community hospitals. There were no urgent care centers. They added like 20 urgent care centers, and we were the people responding to all of that without really any change or acknowledgement, in my opinion. I felt like there was an inequity and lack of transparency within the system for both compensation and then promotion to leadership roles, not necessarily like academic promotion, but roles within the division and department. And leadership without accountability. And what I mean by that is that the leaders kind of would do whatever they want without any feedback or responsibility to that. And then I think the last 2 things are probably very global issues that we're all facing in medicine is this progressive loss of autonomy, where people are telling us what we're supposed to do. And perhaps unique to females, but all genders, but this clear gender bias. So an expectation about how women are supposed to act, how they're supposed to dress, comments about when you're pregnant or when you take off for maternity leave. And this quote, it was not said by Christy Weber, but I think Colleen just saw it in another meeting, so I think people are kind of catching on to this, is that the culture is how we behave in an institution. And behavior can mean a variety of things. So it can mean us yelling, but it could also mean us doing unindicated procedures or being very motivated by finances and not by taking care of patients. So I think there's a big picture here that's a little bit hard to grasp. So my lesson learned from that with lots of reflection is that I'm not a failure, but parts of the system are failing me as a physician. And I thought this was maybe interesting to highlight. Many of you may have heard of this, but the canary in the coal mine analogy. So one interpretation of that is that physicians are proverbial a canary in the coal mine. While the canary may be sick, it is the mind that is toxic, and caring for the sick canary is compassionate, but likely futile until there's no more fresh air, until there's more fresh air in the mind. Jaclyn, who is the chief at CHOP, the former president of POSNA, said, as a canary in the toxic coal mine, I have failed to fix the mind, so I have focused on being the strongest and most resilient canary possible. And as I'm driving to work and thinking about this lecture, like, do coal mines still exist? Like, is that a thing now? I don't think it is, right? Aren't all the coal mines shut down? So, like, is that like an okay analogy to make? And like, Dr. Diep is probably going to comment on this, but like, do I want to be a canary? I don't know if that's a good or a bad thing. I mean, maybe I want to be a canary in a rainforest. Like, I don't know where canaries thrive, but it's a little bit of an odd analogy. I mean, I think which like kind of speaks to how sick the system is. And freely admit that I have some individual challenges that, I mean, are clearly individual to me, but probably common to many in the audience. So I was trying to do it all, trying to organize, do all the food prep, make decisions about which preschool the kids are going to go to. I mean, why is that such a tough decision? Cleaning, etc. Specific kind of maybe mommy parenting stuff, breastfeeding, pumping, sleep training the kids. I'm failing at that right now. Potty training them. And part of my tendencies, and probably many people's tendencies, which makes us great surgeons, is that I'm a perfectionist. I want everything to be perfect at work and at home, and it's really hard for me to give that up. And I can be very overly self-critical and self-aware. So it was clear to me at some point with the combination of both work and home that it just wasn't working, and I just needed a reset. I needed to get back to these happy pictures and less of the frustration. So, big lesson learned that it's okay to fail and seek a second chance. So thank you, UCSF. When I came to interview here, it was just very clear to me that I was going to have very supportive partners and leaders. And the opportunity to collaborate with a mentor to help build this great limb center. So I'm very thankful for this opportunity. And amazing weather. That's the view from my rental. And the kids on their first day of school. Okay, so just to try and kind of bring this together in terms of, what some of us might have in common with some of the struggles that I face. So this is a screenshot that we all take. Finally used one of these in a lecture. Dr. Greenberg, she is now the chair at UNC. She is a general surgery. She's a surgical oncologist. But has done a lot of work in public health. And this is her slide about the interaction of gender and home life. Emotional exhaustion, if you guys probably remember this from like the burnout score, that's like one of the components of the burnout score. It's the big one for females usually is emotional exhaustion. But this slide to me is just like the epitome of what I was feeling. It said, like, I was married and that was even more stressful than not having a partner. And one thing that has been shown in some studies is that having a partner that's non-medical, and my husband's an engineer. Oh, yeah. Yeah, of course. So it's a scale of emotional exhaustion and then relationship status on the bottom. And estimated like marginal means is on the y-axis. And so it basically says that for based on your relationship status, like moving along the x-axis, being singled to married, it's less stressful. Like you have less emotional exhaustion if you're a male and you're married, but your emotional exhaustion for a female goes way up. And then similarly for having kids, if you have kids or you don't have kids, it goes way up if you're a female, but it actually goes down if you're a male. It's just like fascinating. And I think it just brings this like second shift concept and the she-fault parent concept like into view and perspective. So the second shift is from the 1980s, which is I think still very relevant. And then Fair Play kind of has a similar take on it with this she-fault parent, is that if there are two tasks that are equally created equal and you have two working parents, that the female is going to end up doing more of the tasks. So, I think I and many of us fall into these, that we have a partner that is employed full time. That's more and more the norm. And then, the question is that who does the domestic work at home? Who organizes the kids? Who does the activities? There's this concept of outsourcing, which I think is like fantastic. So the concept, for those of you who are not familiar with it, the residents maybe, is that like things that like someone else could essentially do, and it doesn't matter. The end doesn't matter. So cleaning, doing meal prep, all of that stuff that you could pay someone else to do. I think that's a fantastic idea if you have unlimited resources. In the Bay Area, we definitely don't. But the other thing is that it's not that easy. You need to figure out who's going to do your cleaning. You have to hire them. You have to manage them. You have to coordinate with them. So it takes away maybe some of it, but it doesn't necessarily take care of all of it. And then just kind of an example of like kind of the she-fault parent concept is that every email chain is the mommy chain. There's no daddies on the chain. All the birthday invites come to me. These are the mommy text chains that inform us of all the upcoming school events. Like who has lice that day, who has strep throat, what the appropriate treatment for lice is. So, I mean, my husband, like I have to screenshot it and send it to my husband, right? Like he is not getting any of it. We actually had this conversation because it's the middle son who's about to turn 6. It's his birthday party this weekend. And he asked me something about the invite. And I've totally said that is not, I'm not doing that. And I was like, I don't know. Like it all goes to the moms. What are you talking about? And he's like, oh yeah, I sent it all to the moms. You're right. Like, yeah, you did. Because that's just how it works. So, I mean, this is like kind of, I wanted to come back to this point. I mentioned it earlier because I've spent so much time thinking about it. First, it was like work-life balance. Now it's work-life integration. I just think the whole thing is a misnomer. I just, like, it's all life. And we need to figure out what pieces of the pocket it are. But, when we start to integrate, there's no boundaries, which I think for the work side of it means that the work usually predominates the picture and takes over the home family side of it. So what I've learned that, this is a very big statement, but there's limitations of time and energy. I can't do everything. I can't be everywhere. And so I need to prioritize somehow. And just like kind of digging deeper into this a little bit, this is not just like the home-work balance. This is at home and at work, right? So at work, I can't answer a million emails and see however many patients and finish my notes and be on 5 committees and, interact with the parents. So I think in each area, we need to prioritize and figure out what we're excelling at and what actually needs to be done. And then, when you are someplace, focus on where you are and not trying to be everywhere in your head at once. Let's see, the picture collage. That's my middle one, Matthew, and then Emma at the art space in Marin. And that's the puppy who ran away, but I like Phoenix. You may or may not see she has a GPS tracker on her. So where am I now? So trying to reprioritize at home, trying to figure out where I really need to focus my energy and admitting that it's okay not to be perfect. So it's okay if the house is dirty, that laundry isn't put away, etc. And that when I am at home, that I'm really there so that I'm spending time with the family without distractions. And the kids know. One of the things that my middle child always says to us is watch me the whole time. Because he asks for your attention and you're like, yeah, I'm watching. And then you put your head back down. Like they know what's happening. And now as they're older, they're like wanting to see what's on the phone. So I've really tried to distance myself from this phone. I've taken my email off my phone. So I apologize, Dr. Pandit, for not responding to emails. But like, I think our personality tendencies are such that if it's on there, we keep on checking and we want to respond. And we're not doing a good job trying to do it all at the same time. And then, like us all, we try to sleep, exercise, and eat well. I wish I could do all of those things, but an aspiration. And then in the bigger kind of medical system, how am I trying to navigate? So one of the things that I've spent a lot of time on, and thank you for including me in the UC Women's Leadership Program, but there was an introduction to an executive career coaching firm, which kind of elaborated a little bit on a little bit of a personality profile, so I could understand my personality tendencies a little bit better and how I react to things. So one way that I'm using that is trying to focus on what I can control and influence, because really that's all I can control, and the things that I can't control, I'm just trying to let slide off my back and not invest so much energy into. One of the ways that I'm trying to do the kind of the thinking and behaving, because one of my tendencies is to want to answer everything immediately, because that responsiveness to kind of get it all done is just pausing a little bit and thinking about it. And so again, you're not giving the immediate response in terms of text or email and really processing it to see, okay, what's the appropriate reaction to this, and weighing the different sides of it to make sure that I'm looking at it in a balanced way. And then again, at work and at home, trying to not overcommit to too many things so I can focus on the individual tasks, because even despite what, COVID had tried to teach us, we do not multitask well. We can only do one thing at a time. And when we try and switch back and forth between a lot of things, at least in my opinion, we do it somewhat poorly. And so we should focus on what we're doing. So we should focus on the patients in front of us and taking care of them. And then when we're at home, focus on our family or whatever else the priority is there. So now really trying to dumb it down. Kindergarten is no different than the operating room. So my middle one is in kindergarten now. His kindergarten teaching is amazing. If I could be like this woman, I mean, how she deals with this classroom and how she just handles the class is amazing. And the sign on the right is what's hung on our bulletin board at home. You can see at one point I ran out of O's, so there are the googly eyes in her. But I mean, if we could all treat each other this way in life, in general, at home and at work, I think so many of our solutions would be solved. So many of the problems would be solved. It really makes you try to interpret things from both sides, hear everyone out, and be kind to everyone in terms of what biases there may be. I think I left lots of time for discussion.
Thank you, Dr. Hill, and welcome. And that was great sharing, and thank you. Thoughts or questions? Comments? Dr. Safarwal?
Thank you for, being so open and transparent and quote unquote vulnerable, as we all talk about that. But I tell you, we all struggle with this, and just on the side, it's refreshing to have you, here at UCSF. And truthfully, I wasn't sure how, it's all going to mesh, but so far, so good. More than so good. So keep on going. The one thing I also struggle with, just like you, is, should we look at the differences in how I can individually succeed? And I'm not just saying it to be PC, but really to just look at the commonality, to see, yes, we're all so different, but what is the common thread? And I think that goes at so many levels. And yes, you can dumb it down and you can over-intellectualize it. But to me, for whatever quote-unquote successes I've had, is when I've sort of lived that life of just saying, okay, we're all so different, but really it's sort of the same stuff. No matter where you go, where you are, who you are, it's kind of the same. It's a way to sort of unite your thinking and your interactions. So, I think it's pretty obvious, but just something I also struggle with, and I think it's worked for me. So,
okay, I have some. Mike,
not surprising.
Thanks for that. It's really great, and how great that you would be so soulful in talking to us. It's really great. Okay, I'm just going to say one thing. On NPR, there's this thing called This I Believe, and it was an essay program that was started in the 50s. Someone knows more, correct me, but I think it's what it is. And the first prize was given to a woman, I think her last name was Deutsch. She ended up being a professor of biology at Cornell, because I heard her talk. Her essay was titled, Wherever You Are, Be There. And I was thinking about what you were saying about put your phone down. And then I think about the struggles, which is great that you would even admit that you fail. We all fail. I mean, I've failed so many times. And then I think to myself, we're in a system that does not reward that. It doesn't reward doing one thing really well. It rewards us being super people, right? So it rewards us not wherever you are, be there. Wherever you are, be 100 places. And how do we get back to that? And I think it may be, I have lots of ideas about it, but for example, the running more than one route is not being there. And then what we say is, but I was there for the critical part, which is to me kind of excuse making. It probably wouldn't work with your son. You would say, no, watch me all the time. And when we did that study on multiple wounds, that's what we found. The patients wanted you to close the wound. They wanted you to open the wound. They didn't think that was not critical, and so on. So how do we sort of try to fight that? Is all the pressures are do 100 things all at once, and how do we get there? And I think one of the problems I struggle with is it's kind of devaluing us. So if you're a good 3-point shooter, you're invaluable to a team. That's all you do. One thing, but you're so important. But if you're one really good thing in what we do, maybe it's not enough anymore.
Thank you for a great talk, Dr. Hill. Just a couple of quick points. One is a slight response to what Dr. Diab just said. As a future arthroplasty surgeon, obviously hoping to run 2 rooms one day. I don't think it matters if the resident's closing, if the attending's in their second room, or if they're writing the op note somewhere else. So it ends up being the same thing. Somebody else is going to be closing. So let's not worry about that part, I don't think. But I do have a serious question. As we are developing our identities as professionals and as people within our families, how do you choose what to sacrifice? How do you choose what to prioritize? Because I think most of us recognize if we put all of our time into this, we could be even better. If we put all of our time into that, we could be even better at it. And so leaving anything on the table just doesn't sit well, but you do have to do that at some point. And so how do you make those decisions with your partner, with your family, with your children, or just decide what you can accept on your own and kind of start from that point?
Yeah, I mean, I think for me, it's like an evolution, right? So you probably go into it with one idea of what your priorities are going to be, and then, things change as the kids grow. Obviously, if you have as a family and they have different needs when they're babies versus when I don't have teenagers yet, but I assume when they're teenagers, I mean, it's different now as they're 6, 7, 8-year-olds. And so I think one of the things that I've learned is that you can't have a set target. It's a moving target, and you need to be able to be versatile and change it, but keep a common theme that you're going to be present and there for them and whatever those needs are. And I think I need to, I don't know what the right pronoun is, but if we're going to choose to have a family, you need to give them part of you. You can't just say it's all work, right? It's all part of life. And so it needs to be, you need to figure out what that balance is for you that's going to keep you happy and keep everyone happy in your family.
Let's see, Dr. Baldwin.
Hi. I think the part of this talk that resonated with me a lot was the canary analogy, and something that I've always put a lot of thought into about how do you change culture. And if you're the canary, can you change culture from the inside? And what does that mean? Or do you eventually assimilate into the culture that you did not want to become a part of, and you make, just personally speak, excuses for survival? Because that's part of how you then are able to then say, okay, when I get to their side, then I'll make the change. Or when I get to this point, then the change will come. So how do you, is it you're that canary or you're that person as a resident, or you take pieces and you decide what you're going to take or what you're going to give, or kind of how have you navigated that aspect?
Yeah, I mean, I think big picture from where I am now is that I probably was trying to be a canary and I didn't fit in very well. And so I think we have to realize, or for me, what my realization was is that this is a broken system. And so I need to figure out how to navigate in the system, but I don't necessarily need to be a canary in the system. So I think asking the questions, which is just fantastic that this is a forum that we can ask the questions in, because I don't think I would have felt like I would be in a safe space in my old institution to ask these questions. But to ask the questions, what is broken with the system? Can we change those things that are broken? But knowing that change for the culture or whatever the system is going to be really slow. And so how do you still thrive in the system as you're trying to change it?
Dr. Hill, thank you for that fantastic talk. And it's certainly been a privilege and an honor for me to have known you for as many years as I have. I was a chief when Jackie was a 2. And so we were on the trauma service together and spent a lot of time, and it's been beautiful to see your evolution. I just want to, you mentioned the word failure a few different times, and I want to sort of push against that and say, recognizing that the environment that you are in is not conducive to your health and happiness is not a failure, right? Continuing in an environment that is not conducive to your health and happiness is the failure. And so I just want to acknowledge that the strength and the self-reflection that it takes to look around and say, this is not my place, like I am not thriving here, is really, really important. And I think that's an important thing for our trainees to hear, for all of us to hear in whatever aspects of our lives, right? Like to recognize that you can try to change the system as much as you have the energy and strength to do, but sometimes that system, as you just said, is not going to change. And the failure is keeping yourself in that system to your own detriment. So I just want to acknowledge that is not a failure to say, I need to be someplace different. And I would just ask, were there any sort of steps that you took, people that you talked to, books that you read, anything that you could sort of share with the group that helped you sort of find that strength or find that sort of direction to recognize that you needed to go elsewhere? And maybe not even just in your career move, but in other things, right? Like this is something that we all struggle with.
Yeah.
How do you make those priorities and decide it's time for change?
Yeah, that's a challenging question, but a good one.
And we all probably have different answers.
Yeah, I mean, I think kind of being in a not great situation, there are many outside of work, I think we all have these instances in our life. I think there's just a lot of self-reflection about is this what we want to continue in? Is this relationship really helping me? Is this position really helping me? And of course, you find people that you can bounce those ideas off of to see if it makes sense, right? Because sometimes the narrative in your head is very is one-sided, and so trying to find people that you can bounce it off of. So I mean, for the work decision, Dr. Kasser, who's the chief at Boston, the old chief at Boston, was definitely a very stable sounding board. And he is great. He is a great listener, but he also has a ton of experience. So, I think that kind of combination of the two. And I think the other thing that I've kind of learned in this journey is that you can see from how I decided I was going to be an orthopedic surgeon, I just got it in my head and that was how it was going to be. And really no one could tell me any different. It didn't matter who I met with. And they told me, oh, you should be a dermatologist. The work-life balance is so much better. And I was like, no, I'm already going to be an orthopedic surgeon. Doesn't matter what you say to me. But I think the ability to hear what someone else has to say, which is really hard for me. I form an opinion and that's my opinion. And so, yeah, that the rules to, wait my turn to speak. I need to listen to hear what other people have to say because they probably have something that I haven't thought of yet. And then take a step back and process it. And I mean, like, this is, I mean, you're talking about really big decisions, but I think like everyday decisions, like the email that gets sent off and someone does it emotionally because they didn't like what happened, being like, okay, I understand that point of view. What's my point of view? Can we reach a middle ground, right? So I think it's such a big life skill to be able to take a step back and do that. But yeah, that's a great question. Thank you for asking it.
Then we have a question or comment on Zoom from Dr. Schroeder.
Hi, can you hear me?
Yes.
Okay, cool. Jackie, great talk. I really enjoyed hearing it. And I just kind of want to comment again on the canary thing and the culture change. And one of the things I think that's really important as parents and as primary parents or secondary parents or however we kind of define ourselves is, for me, it's always been really important to make people know that like it's equally as important for me to be a good surgeon as it is to be a good parent. And that might mean having to leave in the middle of the day to go like serve lunch for my kids and come back. And I think one of the things that's really important is that we need to be equally honest about doing that instead of just saying like, oh, I have an appointment and I have to go. I think it's really important to say like, oh, I need to make it to my kid's soccer game and that's important to me. And I'm going to like postpone this OR day because it's my kid's first day at school. And being open about that and being willing to like say that, I think it's something that in the culture has certainly been kind of hidden and protected for a long time. But for me, it's really important that we do that. And I think that's how you help culture change.
Hey, Dr. Hill, thank you. And welcome to UCSF, and hopefully this will be a, different experience that you have. And thank you for, sharing a lot of your personal experience and being like, vulnerable. This is important for us to kind of know who you are. But also I want to, kind of, go with what, Dr. Schroeder mentioned earlier too, is that, and I was kind of, encourage your faculty and also like, training too, is that share your experience. I think, most of the time that we feel isolated or vulnerable is because we can't share our experience. Most of these experiences may be common to your colleagues, and your friends, and others over there. I got the phone call about my son had lice on his hair. I had to go pick him up. And Anita refused to wash his hair, so I had to wash his hair. Find a special, shampoo. So I could totally resonate that over there. But I think, the other thing that also, it would say is that give yourself more credit. I think most of the time when we become physicians or become parents and become, leaders, is that give yourself more credit. You are multitasking every day, every minute. You're multitasking. You have a family, you have great kids, a spouse, and doing innovative, work and taking care of patients. You're multitasking every second, every minute. Sometimes you just need to prioritize. I think that's important. And there are skills that that we could learn. There are things you need to kind of make sure that, hey, this is just not my work today, so do it for me. Push back a bit over there, but I encourage you to kind of develop that relationship and structure in your life, and again share. There are a lot of us here to help and try to make it better. So thank you for being part of the faculty, and hopefully we're going to work together a lot more. Thank you. Thank you.
So I went to Baylor, and so I knew about Jackie before we just met an hour ago. I knew about her, and then so when I heard she was coming, I just sent a text message, "Hey, how's Jackie?" And the response I got from people is, she's great to residents, and she's a great teacher, which I think is like the thing I value the most from educators. And so I want to say welcome.
Thank you.
And one thing that we do here at UCSF is we work well together. And I'm a big proponent of doing code cases. So I met you and I said, I'll give you my number. If you need any help, just give me a call. And so I think it's a good way to stay connected within the faculty. It's not that we can't do the cases ourselves, but it's just more fun to do it together. So
thank you.
All right. Any other comments, questions? Otherwise, I think we'll wrap up there. But Dr. Hill, thanks again so much.